I am Dr. Twa-Twa, Mutwalante Jeremiah. I come from Uganda and I'm a medical doctor by training. I have both public health training and a degree in medicine, together with some training in demography and biostatistics. That's my background. I'm a member of the Uganda National Association of Community and Occupational Health. That's how I come to enter the World Federation of Public Health Association. But currently, I'm also the Dean, School of Health Sciences in Kampala University. I have before or previously worked with the Ministry of Health since 1980. I worked as a manager of a 200-bed hospital and also as a district manager. That's how I come into public health. I did a lot of that for over 5-6 years. I was also in the first team which started the Uganda AIDS control program in the mid-1980s. I worked in that program for about 6 years again. Then I was assigned to lead the doctors as a registrar of the Uganda Medical and Dental Practitioners Council. After that, again, I was assigned to head the Child Health Division in the Ministry of Health up to 2010. After that, I joined the politics and I was in the Parliament of Uganda for 5 years. I came out. Now I'm a professor or lecturer at the Kampala University, where I head that faculty named School of Health Sciences. I do teach public health, epidemiology, demography, and biostatistics. That is my assignment. And of course, I'm currently the co-chair of the World Federation of Public Health Association, NCD working group, together with my brother, Prajjwal Pyakurel from Nepal. And together, I think we have the strength and the commitment to move forward the NCD agenda together with our colleagues. I think that's basically my introduction. I'm a married person with children, grown up. Some of them are doctors like me.
Hello, everybody. I am Dr. Prajjwal Pyakurel. I am from Nepal. I am currently the General Secretary of Nepalese Society of Community Medicine of Nepal, which is equivalent to public health associations in Nepal. We have more than 200 members in our group, and I have a deep passion and interest to work for NCD prevention for the global population. I was a visiting Lowndes Scholar in 2016 at Harvard T.H. Chan School of Public Health, Boston, Massachusetts, USA. And I was a fellow of International Society of Cardiovascular Epidemiology and Prevention. I'm a life member of World NCT Federation. And, I have been working in the field of NCD since 2011 as a resident of MD Community Medicine So I've been working for more than 10 years for NCD prevention. So due to my interest and passion for NCD prevention, I got opportunity to be connected with World Federation of Public Health Associations, NCD working group, and luckily I was nominated as a chair. In my mid-career, I was nominated as a chair. That is a big, I believe that is a big compliment, a big responsibility towards me for NCD prevention work for the global populations. So in coming 20 years, I want to work for the NCD preventions for the global populations and contribute in whatever aspects I can do from my side. Serving the people, serving the humanity was my primary approach. So being an academician, What I always felt is, the first priority of an academician, researcher, as a public health professionals, you should focus on the service part. Service part is very, very important. So how you are going to service the people and humanity, that motivated, me to join the public health, as a subject. In 2011, when I did my residency in MD Community Medicine and Tropical Disease, so that I should do some work which will impact the global public health. So at that time, I was a resident, and then I got chance to conduct my MD dissertation on cardiovascular risk factor among industrial workers in Eastern Nepal. So I worked with the industrial population for about 10 years. And working with them, motivated me more because they are from a very poor background, low pay scales, and they are doing labor class works, and always they have competing priorities. So I thought that, as a public health professional, I can contribute towards their cause. So because of serving the humanity, I joined the public health. And also, I want to conduct different forms of research, operational research, implementation science research, health system research, which could leverage, the Ministry of Health and Population of the host country, and the global health populations, to design, policy and practice changes for NCD preventions, So, uh, because of a lot of passion and interest, I joined public health.
Of course, what motivated me to join public health, first of all, I would say it is probably some inner feeling within me, right from the training, when I was training as a medical doctor in the 70s. Of course, I did qualify in 1978. But during that time, in my first degree, I got exposure to one professor called Professor Kakande. He's now late, but was a professor in public health. I got interested in his ways of teaching, and I got interested in the subject of preventive medicine. That was really the beginning of it. And of course, I pursued the training. I qualified. What again brought me more interest is that in 1979, 1980, we had a problem in Uganda, as you recall. That was the beginning of the era, or the period for President Idi Amin. And you know what happened in Uganda because of the regime, and many foreigners were expelled, including actual Asians. And that drove out many doctors or health workers who were actually providing services. So I was deployed in one of the remote hospitals and districts. Immediately, I was given assignment by the Minister of Health to head the hospital and also to head the district. I had no alternative but actually to gain the interest and take on that role as a manager of health services at the hospital level and at the district. Because of that beginning, I had to undergo further training, which the Ministry of Health facilitated, so that I could get the expertise, more expertise in public health. And after that, I had no alternative. I was on no return journey, but to pursue public health. And that's what I've done most of my time. Because after the district assignment, which I told you about, I was again in 1987, 88, one of the members of the first team, which put in place the Uganda AIDS control program. And in there, I led the surveillance aspect of the program. Again, after that, after we had done that, when there was a need to do administration of the doctors, I was again moved on to do that. And subsequently, later on, I headed the child health division. As you can see, the deployment further consolidated my liking for public health. But does not mean that I don't like the clinical work. I still do some bits of clinical work, but I'm more oriented and focused in public health.
So,
Yeah.
I was officially the member since 29th September 2022. I was the member, and I've been working in this group since 2022. But I was nominated as a co-chair along with my fellow colleagues, Dr. Zormia, on 3rd April 2024. So I think 3 months back, we both were nominated as a co-chair. And then since 3 months, we have been working as a chair in this group.
I would say that I've been associated with this World Federation Public Health Association for quite some time, because the Uganda National Association of Community and Occupational Health, we are members of the World Federation of Public Health. And our executive director, Dr. Sekimpi, has been sitting on the board for quite some time, and he is still there. Out of that connection, I was nominated to join the World Federation of Public Health Association in 2020, and I've been a member since that time. When opportunities came for selecting new chairs, because the previous team, I think they sort of resigned, well, we expressed our interest. And I did express my interest, and that's how I find myself that I was voted to be one of the co-chairs together with my brother, young brother, Dr. Prajjwal.
The current activity is, what we are doing, because we are just 3 months old as a chair in World Federation of Public Health Association NCD groups. But we have started our work. We are starting to conduct webinars. We are planning to conduct webinars every month, starting from 18th July onwards. We are trying to, 18th July, we have already fixed the webinars, and every month we are planning to do the webinars. We are planning for a policy brief trainings discussions. A few days back only, we have a meeting with the policy committee chair of World Federation of Public Health Associations, ITFANSO. So we are planning for a policy brief training to all the members, working group members of NCD, along with their respective public associations from October 2024 onwards. Similarly, we have started conducting regular meetings. Every month we have fixed meeting for on the 3rd week of English calendar months. On 3rd week of English calendar month, there will be a meeting of working group, NCD group. And the preliminary draft, preliminary draft of 3-year action plan 2024 to 26 has been prepared by Dr. Zormia and myself, along with the one-year action plan to be implemented from July to December 2024. So we have developed this plan, and we have communicated with different international organizations in our respective countries regarding any sort of collaboration. We have wrote proposals together, and we are trying to get fundings for those proposals, so that we can conduct a capacity building trainings program in different regions of the country, different regions of the world. So we have tried our best. And our vision is, vision is what you want to accomplish, and we want to accomplish a lot as being a chair of World Working Group NCD. We want to achieve a lot, and accordingly, we have prepared action plan for coming 3 years in alignment with WFPHA goals. According to the 7 goals, we have aligned our plans. For example, goal 4 talks about develop and advance public health knowledge, education, practice, and research. So in our action plan, we have thought of, conducting mass awareness and screening campaign focused on young people, conducting webinars from participants across different regions of the world, rallies at once through public health, World Federation of Public Health Association banners on special days, and model NCT health promotion materials for school and workplaces to be customized by national public health associations, conduct research capacity building training for young public health professionals, and conduct literature review to identify ongoing NCD control activities and gaps in evidence that are available at the regional and global level. And similarly, for each goal of WFPHA, we have designed our activities and the deliverables. So our vision is in alignment with the WFPHA goals, mission and goals. So we have formed our 3 years action plan, and coming meeting on 25th July 2024, that will be endorsed by our working group, and then we'll start our further activities of the working group.
I will add that we are developing an action working plan, which is all inclusive. We are starting, we have the draft, but we are including the members' opinions. That's why in the next meeting, we are going to discuss the draft so that all of us, we can agree how we move forward in the next 3 years, addressing this issue of NCDs. Our vision definitely is in line with the goals and the vision and mission of the World Federation of Public Health Association. On my part, I would like to see a vibrant World Federation of Public Health Association, NCD working group, which is felt at the grassroots, particularly among the national public health associations. They should really feel that we are there to provide the guidance, the support, in the activities which we do. Once we do that coordination, I think we would have achieved a lot, because I would like to see a lot happening down there in terms of advocacy for these NCD problems. The seven goals are there. My colleague has elaborated, but in our view, it is necessary to address every aspect of the goals, at least in one way or the other. Like he said, when goal 1, for instance, we would like to see that we develop policy briefs, for instance, on alcohol, drugs, unhealthy diets, and so forth. Goal 2 talks about contributing to promoting systematic change and the colonization of public health. We would like to do, for instance, in that area, to develop a roadmap for sustainable funding of NCDs, because as of now, it is a bit of a problem in funding NCDs. We can develop that, we can then guide the world. We would like to contribute on a goal of 3, contribute to strengthening and democratization of global health governance. We would like to develop cross-border mechanism for strengthening the prevention and the control of NCDs. We would like, for instance, in Uganda, I would like to see how Uganda, Tanzania, Kenya can work together to address NCDs. Number 4, goal 4 is develop and advance public health knowledge education. Here, we are going to support or guide the public health associations to develop these advocacy initiatives or materials so that at the grassroots, these are addressed. Goal 5, grow new and strengthen existing partnership with groups and individuals who share values. Here, we are already started and we shall continue to engage the government machinery, Ministry of Health, development partners, and the parliaments to see how we can strengthen this partnership so that we can address the NCDs. Goal 5, support and strengthen membership associations. He has talked about that, but we are going to conduct capacity building, particularly of the leadership of public health associations in the management or advocacy for NCDs at that level. And lastly, goal 7, build an effective and efficient, responsive and sustainable World Federation of Public Health Association. Here, first of all, ourselves as NCD working group, we need to ensure that we hold regular meetings so that we stay together as a team to address the issue of NCDs. We are going to maintain close contact with the leadership of the World Federation of Public Health Association so that we get their guidance how we move forward as an NCD working group to address the issues. So that's how we are relevant in terms of the goals and the mission of the World Federation of Public Health Association.
You know, this World Federation of Public Health Associations, I believe, has more than, around 500 million, 5 million colleagues over here. So, it is a huge network from different countries and different colleagues from different backgrounds coming together for a common reason, to advance science and global public health. So this is, I believe, is a huge network. And for example, in our working group also there are colleagues from different countries. So we can learn from each others about the country context and how can togetherly we address the global public health issues. So in that way, this network has helped us to foster a collaborations, partnership, and online discussions, so that could be learned from each other, from us, so that it could be replicated in our country context as well, and as well as for the global public health. So I believe and leading this group, leading and being a chair of World Federation of Public Health Association, NCD promotion, and especially from a low middle income country setup. So I'm from Nepal. I belong to LMIC setup. So it's a huge privilege, I believe. That is also a huge privilege for us to sign at the global level. So I believe that this has given us a lot of opportunities, but how we are going to use this network for the prevention of global public health is very crucial and vital in upcoming 3 years.
In addition to what my colleague has said, it is important and relevant that as we work in the group, we should be mindful of the people who have worked before in the World Federation of Public Health Association. And we have already started tapping into this web of experience by consulting. For instance, we have already held discussions or meetings with the immediate past president, Professor Arayo. We have had that meeting. And recently, we have also had good discussions with Professor Ildefonso Hernandez, who is the chair of finance. And that is quite useful. That will help us to build ourselves how we address the issue of the NCD working group.
So broadly, we will work for the NCD prevention and health promotion, and all that also includes the nutritional policies.
The group which we are, the immediate past group, definitely they were doing a lot on this diet and nutrition. That's why on the web we have that statement. We are going to definitely consult and work with that group because they are members of the NCD working group. There are some works which they have before engaged in, including preparation of policy briefs of some kind. We are going to take up that and move forward. And good enough, of course, the World Federation of Public Health Association, they are member and they sit on that board of Food World International Food Standard, the Codex. They continue to sit there. We shall see how we can fit in at the international level as the NCD working group and also carry it down. How do the public health associations at the national level. Also getting to influence policy at national level as far as the food diets and whatnot, the standards are concerned. That should be definitely one of the areas in the activities, and it is already we have included it in the work plan.
Regarding the nutritional policies, it's very important that we design some sort of policy documents or policy guidance to the World Federation of Public Health Associations so that it could be taken up in the UN Assembly. That's very important. So my say over here is how we are going to change the the food nutritional food habit, behavioral change habit among the next generation, younger colleagues, in upcoming days. That's very crucial because these days, there is due to urbanization, there is a globalizations, there is a economic growth, population growth, and this has led to the increase in consumption of unhealthy diet, unhealthy food, junk foods, So it's very important that as a team of NCD working group, World Federation of Public Health Association, we design some sort of strong policies on nutritional labeling and banning of some of the junk foods in different parts of the world, so that and imparting knowledge to the children, on avoiding the consumption of junk food. I think that is also very crucial. So I believe mass awareness should be raised regarding this nutritional food labeling and policies in future days. In goal 5 of World Federation of Public Health Association, there is a statement that uh, grow new and strengthening existing partnership with groups or individuals who share our values. So our goals is in alignment with the World Federation of Public Health Association. So in our action plan, in the upcoming 3 years action plan, we have vision to engage national governments, parliamentarians, and UN agencies in collaboration dialogue to control NCDs and implement NCD control protocols. So we are thinking in that way. We also aim to prepare copies of engagement reports, copies of follow-up actions, and copies of policy brief, so that it could be it is strongly documented, and that documents could be taken up by the leadership of World Federation of Public Health Association at the highest level, UN Assembly, to bring the changes in the agenda of NCDs for the global populations. So we aim to engage a lot of parliamentarians, UN agencies, the government officials working in the field of NCDs, and bring different line ministries together, for a dialogue, so that we could achieve, we could use our networking partnership and do some sort of different works in different parts of the world.
I think this is the way to go, and we have already embarked on that journey of really engaging the various stakeholders in the control and prevention of NCDs. Locally, for instance, in Uganda, I have already contacted the Ministry of Health. I've visited them and held some successful discussions with them. I'm already part and parcel of the team or working team, which is developing the NCD action plan for the country. So I'm already, they have invited me. I'm regularly now attending those meetings. I've similarly contacted the UNICEF, WHO, seeking collaboration to see how locally we can work together in synergies, World Federation of Public Health Association, together with the efforts. This one, they have welcomed me, again with the UNICEF. We have discussed or had the initial discussions, and we are planning to have more and more of that, depending on what we have discussed. And I think they are positive developments. The WHO, I'm yet to meet them on their part. I'm also planning to engage Parliament particularly for policy developments. I've earlier been in Parliament, of course. As I told you, my background, initially we start from UNACO. And I will report to you that as an association in UNACO, we contributed positively on the development of the anti-tobacco law, which was passed in Uganda. Myself, uh, Dr. Baliamusi, who is now the minister, and another colleague of mine called Dr. Pyakurel, were definitely very instrumental in ensuring that this law was enacted, which I think is effective because right now, when you visit some of these restaurants, bars, and whatnot, you don't get the smell of tobacco like it used to be. At least that one we have succeeded. Yeah. I think that's the way forward, and I think I promise that we have got to do this. If we have to succeed, we have got to seek for this collaboration and partnership, both at national and international level.
Context of my part in Nepal, I have been working with the metropolitan city. I'm in the Kathmandu, the capital city of Nepal, and I've been the technical advisory group member of Kathmandu metropolitan city. For NCD prevention work. So the in context of our country, there is a policies there. The local government has their own autonomy and power. So they have tried to enforce the laws banning of tobacco products. So we are working with those teams on various NCDs risk factor. Additionally, currently I've been partnering with WHO country office Nepal for anti-tobacco campaign throughout the country. So we have a team, young public health associations team, Nepal Health Corps, through which we are trying to conduct a mass campaign in different schools, because primordial, we have to go for the primordial and primary prevention rather than the secondary and tertiary prevention. So it has to be started from school. So this anti-tobacco campaign we have initiated in different schools, and then we have also formed an expert group team comprising of faculties of different academic universities, colleagues working in NCT in different INGOs and NGOs to review the different laws, of tobacco in the country. For example, Nepal is a signatory of Framework Convention of Tobacco Control, which 193 countries have signed. So we are trying to review those documents and see where there is a discrepancy in laws. There may be a discrepancy in laws at the federal level, or the provincial level, at the local level. So you have to bring those laws together, because the tobacco industries are so powerful that if you implement some policies, they will definitely put those case in a court. So we have to be very much careful before they do that. So whatever the laws are there, we have to identify the laws and make it coherent, so that later on when it is implemented, it is not been objected by the tobacco industry. So we have been working on those agendas, as well as I was a part of a WHO package of essential non-communicable disease interventions. So we train different health professionals in the country for NCD prevention through this pain package. And similarly, I have also been the part of National Heart, Lung and Blood Institute USA, as a co-investigator for transnational research capacity building for cardiovascular disease in Nepal. So we have been involved in a different context, different ways for NCT prevention, but it has later on, how much we work from our part, it has to be later ultimately decided by the government. So every government should be very much accountable and loyal, to whatever work they are doing, so that it could be brought into the policy and practice. So these are all my experience working for NCD prevention in context of Nepal. We are part of a working group, NCD group. So World Federation of Public Health Associations has different groups. And it is just not how the World Federation of Public Health Association is going to facilitate us to achieve our goals is very much important, I believe. Because we are the technical experts. We can communicate with different peoples. We can write proposals. We can write advocacy materials that we can do as a team of. But the facilitation at the highest level, and connecting with the different policies committee, connecting with the different finance committee, trying to generate fundings for the working groups, is the responsibility of the WFPHA leaderships and the other teams of WFPHA as well. So I believe this should be team effort, not just a single entity effort, but it should be team effort. If we are really concerned about global public health, all the leaderships, all the working group members, chairs should come together, discuss, and find out ways, how we can take this forward. So I believe it requires a lot of team effort, and I think there are a lot of areas where we can work, especially in NCD prevention. So anybody can work any areas, so just it's a matter of thinking how you go. So let's my place to everybody is, let's work in a team and try to deliver best for the global public health. Thank you very much.
The world should be aware that NCD is one of the worst epidemic or pandemic the world will experience. It is not like an infectious epidemic. An infectious epidemic, you can have an antibiotic which you can apply, or you can apply some preventive measures which can stop it quickly. But if we allow the NCD pandemic to take a route like it is taking now, it will take a very long time to reverse its impact and effect. So the world needs to wake up now than later. Secondly, international organizations like those UN agencies, and of course now this World Federation of Public Health Association, we have the obligation and the mandate to guide the world. We should not think this problem will be tackled by another person. We should guide the world to control the pandemic. So the time is now for action. We should not wait for tomorrow.